And now we're going to bring in psychiatrist and author of High Functioning, Dr. Judith Joseph, for more on the fascination with the suspect. Dr. Joseph, thank you so much for coming on. And obviously, we have this conversation, sending condolences to Brian Thompson's family. But we're talking about the response from many people on social media that does not offer that and seems to almost be, as you have said in a social media post, you're calling it callous. That's how a lot of it appears. There are 112,000 laughing emoji reactions on a Facebook post from United Healthcare parent company.
Oh my God, look at that. 112,000. Only 8.3 thousand reposts and 112,000 laughing faces. Right then, and they think this is callous. I'll explain something in a sec.
To a man being murdered on the sidewalk in Manhattan. Why are people having this? Why is there this collective response from people?
Janae, anger is a healthy emotional response. Violence is never healthy.
Right.
And usually, you're right. Usually people say things like our thoughts and prayers, but people are saying things like our thoughts and copays. And I think that since 2020, there's been...
Okay, there is like a type of... I'm not saying that she's like this, but you do tend to get a type of academic. And there are people in society as well who are just really humorless, worthy people who just don't understand dark humour. They don't understand sarcasm and irony. They don't get this idea of gallows humour or mortuary humour. Because as she's about to talk about, we've been through a lot recently. And as a society, I mean, everybody's been through it. And the medical situation in America is the way that it is. And there's a lot of people suffering and dying. And almost everybody's had contact with somebody like that. And so this is more of an expression of that societal catharsis that it often comes out in this way, in just this really dark gallows humor type way.
A rise in anger. And again, anger is healthy, but there's also a rise in desensitization to violence.
Yeah.
We have nonstop exposure to violent things in the media. People are obsessed with true crime. And frankly, when people hear about violence, now instead of being shocked, they're applauding. So
yeah, again, violence, like so what she said earlier, is that anger is good and then violence is not acceptable and shouldn't happen, basically. But also, anger can be a bad emotion to have, but also violence can be cathartic when channeled in the right way. And I'm not saying this is like a way of condoning what happened, because acknowledging something isn't condoning it, and neither is mocking or parody or gallows humour a way of condoning it either. And you know, it's not new about this violence thing. There's plenty of research to show that exposure to violence on TV and in video games, there's loads of research about how it doesn't desensitize you and it doesn't make you more violent. And if anything, it has been going on since at least 1196, when there were executions in London, and people have been flocking to them until the executions were stopped in 1870. So there is nothing new with what we're seeing here. There is no desensitization. Let me play something for you about so this is by Jay Draper. She's a tour guide in London, and this is a video about would you watch a public execution. I'm just going to play a little bit of it here just to highlight what I've just been saying.
Oh, and people went to these for fun? They treated them as entertainment?
By the 19th century, so many writers have compared public executions to forms of entertainment that it's a tired cliché. One rector, called S.G. Osborne, says that the crowd goes to an execution as to a play and treat it as a sort of gala day. A police inspector called Thomas Kittle said that the crowd behaved as if they were at a prize fight or witnessing a theatrical scene. A sheriff of the City of London called Hilary Nissen said that executions were regarded as a matter of entertainment by the public. The king of doing this is Charles Dickens, who goes to see the double hanging of husband and wife team Frederick and Marie Manning in 1849 and writes, The horrors of the gibbet and of the crime which brought the wretched murderers to it faded, in my mind, before the atrocious bearing, looks, and language of the assembled spectators. Fightings, faintings, whistlings, imitations of punch, brutal jokes, tumultuous demonstrations of indecent delight when swooning women were dragged out of the crowd by the police with their dresses disordered, gave a new zest to the general entertainment. London's history is full of men going to a hanging, watching the cart pull away and the feet kick, and looking around them and going, wow. Everyone here is barbaric except for me. But Maurice Chauncey isn't describing John Houghton's execution because he thinks it's entertaining. He loves Houghton. A not insignificant portion of his description focuses on how brutal the execution is. Sufferings grievous to hear of, fearful to think of, and how much more fearful to endure. He's not the only one. People go to see the executions of those they support just as much as those they hate. When John Tiptoft was executed in 1470, the crowd was so much on his side that they covered his gallows with carpets and tapestries to express their support, and so that he could die in comfort and luxury. According to Thomas Herbert, the people at the execution of Charles I were silent, with dejected faces. So if it isn't for entertainment, at least not always, what reason could one possibly have for going to see a public execution?
See, so there's been a lot of reasons, I think, why people are basically reacting the way they're reacting, and I don't think any of it is due to this desensitization and people being callous. I mean, remember what happened with the OceanGate vessel? And I think at the time that was kind of like a symbolism of extreme wealth combined with arrogance times by hubris equals the OceanGate vessel. And I think that's something that's happened again. And that's the way that people are seeing it.
It's really concerning.
That is the interesting thing, that it seems to be that there are some people who are applauding, or if not applauding, suggesting that they're willing to look the other way because of what Brian Thompson, a CEO of United Healthcare, represents.
No, that's exactly what I was saying about how to recognize and to understand something happening doesn't mean that you condone it. And then she's extrapolating from that people have condoned it and they're looking the other way deliberately. I mean, someone dobbed him in, for God's sake, and ratted him out to the police. So obviously people as a whole aren't condoning it. Yet their speech within their reporting makes it sound that way.
And on CNN's podcast, One Thing, a senior contributing editor at KFF Health News said that she was not surprised by people's reactions because of a, quote, collective frustration with the industry. The real damage, real harms, both financial and medical, that people experience when insurers deny and delay paying claims.
And just from what I understand about social psychology, and just from bloody history, I mean, look at the European Spring in 1848. Just that collective unrest because of the wealth divide and the way it was happening and the way that people were suffering. So what we're seeing here is inevitable. I don't agree with it. I don't think it's acceptable, and I don't think it should have happened because it's still murder. Was it said in June? To take a life is to take your own life. And you know, I firmly believe that. But it doesn't mean I don't think this wasn't inevitable because of the way the industry is and the way that people are feeling and the way that things have been going. I mean, like I've said in another video before about how the fact somebody tried to go for the top target, President Trump, and somebody actually made a nearly successful attempt on it, then a healthcare CEO is going to be a lower value target and easier to access, isn't it? So somebody's already seen that the hardest level is possible. So you've got like the level 68 boss has been attacked. And some 16-year-old kid or whatever was nearly successful with it with no training apparently. So somebody that's got a bit of a head on him and a plan, then he's going to see like a level 32 target as much easier. Again, I don't condone it. I don't think it's right, but it's the way it is.
Investigators have said they don't believe that this was connected to his private life. What do you make of this? And what does it tell us about how people feel right now?
As a trauma expert, and I talk about this heavily in my book, High Functioning, there is collective trauma.
Yeah, you got to plug the book in every interview. Got to plug the book.
You're absolutely right. The trauma from 2020, the political uprisings, the war, the violence, and the injustice. People are angry about the injustice in terms of the wage gaps, in terms of corporate greed. And this is their way of...
You notice that in terms of injustice, she didn't talk about the injustice of the actual health insurance specifically, and the number of people that are dying because of it, and the number of people that are stuck in a long-term suffering because of it. Now, I'll tell you a story, right? My partner had a tumour on the parotid gland here, and because we live in the NHS, it's free at the point of use, but we pay a lot of tax money for it. It meant that she could just go and access it straight away, get it sorted out. So they opened up her neck and got the tumour out. In the States, there are people who can't afford to get the operation done because their insurance is refusing it. And then now they've got giant tumours on their face, which means that the bigger the tumour gets, the more likely there's going to be nerve damage when it's taken out, which means they'll get like a palsy on the side of their face and they're going to be stuck with that for life. Thankfully, that didn't happen to my partner because of the NHS. This is the situation they're in, and she didn't bloody mention that. People should be angry about that. Here is an expert who is supposed to be talking about these things, doesn't mention it.
Of feeling as if they have some control over it by being able to voice and vent over social media. In a way, it's like a mob mentality, the comment section,
Yes.
right? People are banding together to voice their outrage. And it's okay to be angry, right? Again, anger is healthy. However, violence is not. And I think...
Again, violence could be catharsis, but this is like the second or third time she has made that sort of little snippet. And she keeps saying that violence isn't acceptable. But the way that she's saying it as well, and the context within which she's saying it, it's going to anchor in your mind that the people who are liking tweets with funny faces and shit, it's going to be anchoring that to violence. They're not being violent by making parody and humour. Parody and humour, like I've already said, doesn't mean that you condone it or that you would do it. Parody and humour is not violence. She's trying to say that reactions are violence. Understanding something is violence. Seeing something as inevitable is violence. That is not the case, and that I just thoroughly disagree with that perspective. This is why you need to be so careful when you hear things on social media, and then why you've constantly got to be thinking and ticking over. Don't just let it absorb over you. Always be thinking, why are they telling me this? Who is telling me this? What's their perspective? What can they get out of this?
It's a combination of desensitization to violence, this kind of mob mentality, and also healthy anger. It's like a recipe for what we're seeing right now.
And
Okay, so she's pretty much repeating everything she's saying there, so I think we'll call that a day on that clip. There's only